It is amongst the top 3 reasons why people seek medical attention. It's the #1 cause of disability worldwide. In fact, it causes more disability than nearly 300 other conditions worldwide. Chances are that you have before or are experiencing low backache currently. If not, you will at some point in the future. Most of us suffer from what is known as non-specific back pain. We simply just never know why we've got it. If you're one of those, and in fact, even if you're not, this is the show for you. Today we're discussing all you need to know about backache. Be part of the show by calling us with your questions on Johannesburg 714-6843, 6847 or 6857, or interact with us on our Facebook page, SABC Health Talk, and Twitter at SABC Health Talk. Our guests today are experts who treat and interact with people suffering from backache on a daily basis. So sit back, get yourself warm on this rainy day, relax, and learn from this exciting show ahead. I'm Dr. Sello, Motaung, and this is Health Talk.
The lumbar region of the spine, more commonly known as the lower back, consists of 5 vertebrae labeled L1 through L5. The lumbar region is situated between the thoracic or chest region of the spine. The typically has a slight inward curve known as lordosis. The lower back region contains large muscles that support the back, movement in the trunk of the body, spasm or become strained, which is a common cause of lower back pain. Of the lumbar spine are connected in the back by facet joints, forward and backward extension, movements. Segments in the lumbar spine, L4, L5, and L5S1, carry the most weight and have the most movement, making the area prone to injury. Vertebrae are spinal discs, which cushion the joints of the spine and provide support. The lumbar region of the spine are most likely to herniate or degenerate, which can cause pain in the lower back or radiating pain to the legs and feet. The spinal cord travels from the base of the skull to the joint at T12L1, where the thoracic spine meets the lumbar spine. Nerve roots branch out from the spinal cord, running from the lower back through the back of the leg and down to the toes. Some lower back conditions may compress these nerve roots, resulting in pain that radiates to the lower extremities, known as neuropathy.
Right. Now, our lower back or lumbar spine, as we know it, consists of only 5 out of a total of 33 bones in the spine. Could it be that, this section is more important than the others? And what could go wrong in this region? Well, we're going to learn more from our special guest today. First up is Ms. Navanya Ramachandra, who is a physiotherapist in practice in 4 ways in Johannesburg. Welcome to Health Talk.
Thank you.
And of course, next to her is Dr. Doniel Dempia, who's a chiropractor in practice in Parkwood in Johannesburg. Welcome to Health Talk.
Thank you for having us. All
right, we're talking a very common complaint today, that's backache.
Yes.
Right. Perhaps let's start with you, Navanya. If you look at the spine, I mean, we know that there's different regions and so on. What is the role of the lumbar spine in particular?
Well, the spine itself is the major support structure for the body. It carries the weight of the upper body, and the lumbar spine, well, together with the rest of the spine, helps to distribute forces evenly throughout the body. It also protects the spinal cord, and it allows for movement, twisting and bending forwards. Yes.
As a chiropractor, I mean, this is your interest. I mean, you deal a lot with spines and moving joints and whatever. We want to come back to exactly what you do. But why the lumbar spine?
Because the lumbar spine, being at the bottom of the back, is an area where it's not protected by the rib cage. The rib cage actually in the thoracic spine limits the movement of the thoracic spine. So your movement then has to come from somewhere. So you're going to get most of your movement from your cervical, your head, and your neck, and then the lumbar spine obviously moves a lot. So the lumbar spine is where your movement comes from. It's where your twisting comes from. It's where your flexing comes from. It's not the T rib cage part. That's actually very immobile. It's very, very tight and restricted. Whereas the lumbar is important. And then on top of that, it's where your hips are. And if you don't have hips, you don't have legs. If you don't have legs, you can't move. So, it's a vital point, and it's your connection to the ground. So if we can't be on the ground, we can't move, and we can't do all our things.
So if you're to compare the neck, the cervical spine, with the lumbar spine, you'd say, I mean, obviously, I mean, there's no one unimportant region, but which one is more mobile than the other?
So your cervical is the most mobile, especially in the top two, because there's rotation.
Yeah.
So your top two segments of your neck have full rotation, whereas in the lumbar, we've got flexion and extension and a very little bit of twisting.
Right.
There's not as much as in the cervical. So that's why it's more movable, the cervical, but the lumbar takes more weight. Yeah. So your head's less heavy than the rest of your torso, including your head. So the way in which it curves means it takes on all that weight, as well as the ground from the top, from the bottom. Okay. So you've got the top and the bottom.
Right. Navanya, we've just heard about at least you told us about the spinal cord, and we have, you know, these vertebrae that protect the spinal cord. What else do we find around the lumbar region?
Well, other than your vertebra, in between your vertebra, you have what's known as intervertebral discs.
Right.
So this is a cushioning that acts as the shock absorber of the spine.
Right.
We've also got your ligaments. So this helps to connect bone to bone and prevent excessive movement of the spine.
Right.
We've also got tendons. Tendons connect the muscle to the bone. So when the muscles contract, there's a certain force on the spine which helps with movement. You've also then got your muscles, obviously for movement, as well as stabilization.
Right. So it's quite a well-protected area then.
Yes.
Yeah.
Right. So you've got both muscles that move you and muscles that help to stabilize you at the same time.
Okay. Okay, let's look at what can go wrong in this region. We talk about backache, obviously. That's the main topic for discussion today.
Okay.
What can go wrong in the lumbar spine?
Well, often pain can arise either from a muscle strain. So if you do something quite excessive and the muscle pulls, you can get pain. Another common cause of pain is coming from the intervertebral disc itself.
Yeah.
So the disc, it's made up of a gel-like substance in the center of the disc, and then the outer part is a more fibrous substance. And sometimes you can get tears in the outer part of the disc.
Yeah.
And this puts pressure onto the nerves, which then causes pain in that area.
Talk about pain. I mean, I'm told that there's two different types of pain that you can get in the back. There's the one that you can get suddenly, and the one that comes on over a long period of time. Just tell us about that a bit.
So acute pain is pain you'll get, you did something, you had a car accident, or you picked up something too fast, or you know someone kicked you. 100 things can go wrong. Trauma is usually very much associated with your acute pain. Your chronic, that's pain you've got now. I'm sore right now, and I've been sore since yesterday, and I did this. Chronic pain is something that comes on gradually. So either you've overstressed a joint for so long, so you've had bad habits for an incredibly long time, wrong sitting posture at work for months and months on end. Then we get to the chronic side of things, and you start to see wear and tear within the spine, as well as the muscles start to, they get tired of trying to hold a spine in a specific unwanted way. So you start to get what we call chronic pain. So we classify chronic pain only after 3 months. Before that, in the first 3 months, you're still acute. Yeah. So we still treat you as an acute, and that's basically just bringing down inflammation. Where the chronic is a little bit different because you don't have inflammation now. Right. Your body's turned that sense off. Okay. So now the problem's still there, but it's not cleaning it out. So we need to actually, almost in a sense, mildly inflame it to try and get it to sort itself out.
Okay. Now, pain, I mean, obviously, we in my introduction, I said something about non-specific back pain, right? Let's talk a little bit about the signs and symptoms now, and maybe for the purpose of this show, I mean, there is what we call simple backache or benign backache, and there's backache that may be due to other more serious problems. Yeah. What are the signs and symptoms of either of the two?
Okay. Well, non-specific backache is usually pain maybe across the back. Sometimes it can be localized to a certain area. Sometimes you get pain referring down into the buttocks or down the leg. The pain is usually aggravated maybe by a certain movement or a certain position. So that would be your non-specific lower back pain.
Okay. Now, what are those signs and symptoms that anybody should worry about when they get? I'm not saying you should ignore pain, but something
What
that
do
will
you
tell you
worry?
that, hey, you know,
There's an issue.
there's a problem, yeah?
So they're big ones. Your neurological issues are the sharp shooting pain. If you have any incontinence, so you want your digestive system, if it's not working correctly, if you can't control it, those are red flags. If you've had pain that's come on aggressively and you cannot get out of bed in the morning because it's so bad, those are things we really are red flags. Like, that's when we start to look at herniated discs, back tumors, you know, compression on the nerves, especially the sciatic nerve. If it's giving you leg pain, weakness is a big one. If you can't use your legs, you're just weak, or especially on one side versus the other. Things like that, loss of sensation. So the minute it starts to go into the neurological side, we really start to see red flags.
Okay, so neurological, I mean, you mean if somebody starts feeling numbness down the leg, or if the pain goes right down to
even
the heel,
sharp
perhaps,
shooting. If it's sharp and it shoots, it feels like you've been shocked by, like, you know, electricity, then we know that there's a neurological sign. An ache, a dull ache, which is just achy and niggly and it's there all the time, is not serious. It's definitely serious. But if you're not having pain and weakness and you've got all your reflexes, then we're not as severe as if you've lost reflexes, you've got weakness and you lost sensation, then we're onto something more severe.
You mentioned something about, you mentioned incontinence. Is that something you need to worry about?
Yes, that's quite serious. So that can be due to compression of the quadra equina.
Right.
So that is, I would say, medical. You should go and immediately see a doctor. So if you're having trouble urinating, or if you have difficulty controlling either your bladder or...
Associated with backache?
Yes.
All right, we'll just hold it there because we just need to go for a quick commercial break. Please stay with us because after the break, we now discuss causes and risk factors for backache.
Mavis from Zimbabwe examines female challenges using art to address them.
I'm not very good at talking publicly, but I'm very good at expressing myself through paints.
Cape Town Fashion Week showcases brilliant designs.
Trying to kind of contemporize the template, so to speak, of the East African kanga. So that is our trademark.
The Animal Farm story takes you down memory lane.
They are making a film about Animal Farm. A film? What you call a documentary? A what? A film, Muriel. They are from the BBC. How could you let this be? I just need time to see where I wanna be.
My whole message has always been about love. You know what I'm saying? Just love, respect, and be honest.
Join Refulo Mulwa on your one-stop arts and entertainment show every Saturday on Afro Showbiz News at 7:30 p.m.
Welcome back. Now, in dealing with such a disabling condition that costs billions of rand in management, it is surely important that we understand why and how it happens, so that at least we have some idea how to prevent or even manage it. So let's understand the causes and risk factors for backache from our guests. We still have our two special guests, Navanya Ramanchundra, a physiotherapist, and Dr. Doniel Dempia, a chiropractor. All right, we've described what backache is. Let's now understand, the causes and risk factors for backache. And perhaps let's start with the biological factors, those that are innate in a human being.
Okay. Well, your biological factors, so that would be pain arising, as we mentioned, from the disc, or pain from the facet joint or the muscle. So
if there's something wrong with the discs or the joints themselves.
Yes.
Okay.
And that can be due to excessive load placed on the spine as a result of things such as bad posture, excessive load, depending if you've lifted up something heavy and you've put...
We're going to come back to the lifting parts. But you raised something very important here, interesting. You're saying that Are you saying there has to be some underlying condition that will be triggered? In other words, the backache will be triggered by something over and above some underlying condition?
Yes, that is usually the reason.
That's
So
interesting.
you
yeah?
can have a degenerative disc
and be normal.
without any pain.
Right.
You can have osteoarthritis without pain. So sometimes there are these biological factors in the spine, but it's usually the pain is brought on by our external factors and lifestyle and other things.
Talk about external factors and lifestyle. Let's talk about lifestyle. What are those lifestyle issues that can result in or become risk factors for backache?
So these days, I mean, we're pounded by office jobs and computers and work. So the foremost one is posture, bad posture.
Yeah.
Everyone sits behind a computer these days.
Now talk about posture. You're saying I must now.
You see? But it's your laptops are our favorite, but they're the worst for the back. The screen's always too far forward, so we're always leaning underneath it almost.
Right.
It's a big one. So the ergonomics of the workspace is a big problem in terms of what it's doing to your back.
Yeah.
And then we leave the office and we get in our cars.
Before we leave the office, there's this new move. I don't know whether it's healthy or not healthy. Please, your advice is that people are saying instead of sitting at your desk, now you must work standing. You must have a standing desk. Your comment on that?
So standing is great. It's great to stand at your desk, and it is a good plan long term. It's not something you can start today and then stand for 8 hours. You're going to be in pain after 8 hours of standing.
Right.
Start gradually. It's definitely a better way because your spine is designed for standing.
Yeah.
It's designed to take the weight when you stand. When we sit in uncomfortable chairs and we look at computers, it changes the way in which the force is placed through the spine. So it's unhappy. Yeah. So standing is a good way, but we're not used to standing. So please don't go home now and stand for 8 hours at work.
Right.
Start gradually. Start on a Pilates ball instead of your chair. Start, getting your stabilizers ready for when you're ready to stand up at a desk. But standing definitely is the way of the future, and it's the way many people have gone. Many corporates have got standing desks now.
So too much standing, too much sitting, no good.
You've got to find a happy medium, which is very difficult. So like I was saying, we go from work to cars, and then we sit again, and then we think, oh, okay, we've been sitting the whole day, let's go get on the treadmill. So we never change our pattern really. We kind of stick to a routine, and then we get into bed, and we read our cell phones, and further just continue with our bad posture. So bad posture is definitely high up on the risk factors.
Okay, before we leave the workspace, you mentioned lifting heavy objects and stuff. Is there a recommended weight that people shouldn't go beyond, or does it very much depend on the strength of the people? Please advise.
I think it is very dependent on each individual. It depends on how strong a person is, what their core is like. So I think just do not lift something that you feel that is putting too much strain on yourself. I think each individual knows what sort of weight they can manage.
Yeah. And of course, how they lift those weights is also quite important.
Yeah,
we're going to show a clip later on safe way of lifting. But essentially, we say too heavy objects that are lifted suddenly can cause problems.
Yes.
All right. Let's go back to, you wanted to leave the office space and go to other issues.
I always want to leave the office.
Right.
So like I was saying, technology these days is high up, but once we leave that, another big one is obesity. Obesity is, overweightness is causing a big problem. So I tell my patients that they need to look at what your average weight should be. And if you are, let's say, 10 kilograms above that, then go and pick up 10 kilograms in the gym and feel what you put in your spine through every day. Feel it, tangibly understand that if you're more than what you should be, your back's able to hold you. It's able to hold you to a threshold. It's not able to hold you as well as all the added weight. So it's always advisable that we lose a bit of weight because that will put less pressure on that spine. But for people to understand that via words, it's difficult. So go and pick up the weights so it's tangible and you understand this is what I'm carrying around every day. And then we find that weight management is much more understood by a patient, and they can understand why their backs are so sore because they're carrying an extra load. That it's just not structured.
Navanya, we often advise people to be active, physically active, engage in some form of exercise and so on. But some people will say, you know what, some of these exercises that we do actually cause me backache. Or some people would say, look, every time I come back from, the golf course or the driving range, I have backache. Please comment on sports and backache.
Okay. Well, you know, with certain sports require the strength of certain muscles. And I think if you're doing something that is causing you pain, you should maybe try and alternate your sport, or you go to a therapist and find out which specific muscles need to be strengthened. You perhaps aren't conditioned to play that sport as yet, and you need to ease into it so that your muscles can strengthen and your flexibility can improve so that you can handle the sport.
Okay.
Yeah.
Chiropractors talk about spinal misalignment and what have you. All right. Please tell us about that.
So chiropractors, we have a fundamental value in the fact that the spine is where all function comes from. That's your nervous system, your neural cord. So it's the connection between your brain and your body. So we believe that that chain that protects it, which is your spine, needs to be devoid of any kinks, should we call them, a kink in the chain. Can you imagine a kink in a chain? It means that the rest of the chain can't function correctly. So you've got kinks here and there. So when we say a misalignment, we mean that there's a slight, almost a rotation in the spine that's causing it more to be stuck. So it's not really that it's completely misaligned. It's not moved completely to the right or the left, but it's more stuck in a stagnant position, and it's not moving correctly. So what we do when we adjust it, we do a chiropractic manipulation, is we try and readjust that one segment back to its normal rotation.
I'll tell you what, I need you to hold on to that, because I'd like to know a little more about that when you talk about treating now backache. Okay, so how can we protect our back? Please stay with us, because we'll find out after the break.
The city of Durban and its surroundings is one that is filled with history and cultural diversity.
Durban is a natural paradise known for its gorgeous coastline of sun-kissed beaches and subtropical climate.
Flea markets are essential to visit if you want to experience Durban's Afro-Oriental atmosphere.
The city of Durban is an elegant, mature and ambitious city. The vendors at the Vic offer a range of African and Oriental products, an eclectic mix that is hard to resist.
That's Kaleidoscope, Sundays at 5:30 p.m. CAT.
It's a myth that you lift with a straight back. The spine is actually shaped like a lazy S. The lazy S allows for flexibility and should be maintained to ensure a healthy, neutral, round disc position. There are 24 discs between vertebrae in the spine that could be injured by an improper lift. Back injuries include bulged or herniated discs, which most commonly happen from overexertion while lifting improperly. To avoid injury, we need to maintain an upright, lazy S posture. When attempting a lift from ground level, go to a catcher's position. This enables good balance and maintains the neutral, healthy, round disc position. To accomplish this, assume a wide stance, shoulder width apart, with feet diagonal for better balance. Look ahead, never down at the object. Keep arms inside the knees, grip underneath the object diagonally, and bring the load close to the body. Fold the object to your power zone. This is the area between your sternum and belt buckle. Keep elbows in close against your body. Then, fold the object to your power zone using your arms, shoulders, chest, and back. Always bring the object to your power zone before trying to stand. Note, if you cannot fold the object to your power zone, get help. The object is brought to your power zone, the weight is balanced within your center of gravity, and all muscle groups throughout the body are used when you stand. Position, and to transport the object where you want it, use your feet to face your work to maintain a neutral, healthy, round disc position. Never place the object with your feet planted to avoid pinching a disc or twisting your spine. Instead, step in the direction you wish to place the load. Lead with your right foot to go right, or lead with your left foot to go left. The object, always release it from your power zone. Position yourself as close as possible to where you want to set the object. Go to the catcher position and release the object only when balanced and ready.
Interesting, isn't it? Now, you could be preparing yourself to deliver that important critical situational analysis report that your future depends on at work. Or you could be preparing for that most important sports competition or event, you know, like the upcoming 94.7. But severe backache can derail you from your plans. How then can you protect your back to ensure that your path in preparation for these events is as smooth as possible? Well, let's find out from our guests. Navanya Ramachundra.
Yeah.
Danielle Dampier, physiotherapist and chiropractor. Clearly, this is about giving advice to people on how to protect their backs. Okay? The one thing that we haven't spoken about is pregnancy.
Yes.
Pregnancy as a load within people that, you know, acts as a risk to the back. Your advice to pregnant women?
I think the important thing is to try and stay active, just to maintain the muscle strength and the flexibility of the spine. You can do also like pelvic tilting exercises to try and relieve some of the pressure of the lower back. And even gentle aerobic exercises that are going to help.
But I mean, in somebody that has never been involved in exercise before,
okay,
and falls pregnant, you know, what would be the approach there?
I think that they should just do some gentle stretching at home.
Mm-hmm.
Even in early pregnancy, they can start by activating their core muscles to try and strengthen this, to help get them through the pregnancy.
Okay.
Yeah.
Now, Danielle, in terms of, you know, what people can do at home, I mean, we've spoken a lot about at the workplace, you know, about lifting heavy objects,
yes,
and obviously spending too much time either sitting or standing and so on. Let's go to a home situation.
Yeah.
You know, people don't realize that, in fact, some of these accidents happen at home.
At home.
Yeah.
They happen at home because you're exhausted from your long day. So be careful at home. Don't go home after a strenuous day at work and overextend yourself. Coming back to the pregnancy, if you're pregnant, please don't overextend yourself ever. Your ligaments are more lax.
Mm-hmm.
You're going to give birth in a few months. So, you know, you lax. So don't overextend. You're going to be able to move further than you have been. That's important. The other thing is go home and don't be lazy. Don't get on the couch and watch TV.
Mm-hmm.
Get moving a little bit. You've been sitting all day at work or you've been lifting things all day at work. So let's get moving in a good way. So gentle Pilates exercises that you can take home are great. Pilates is an amazing tool for the lower back. I think we get to it later as well.
Yeah.
But things like that are great. Stretch out the back. Lie in the 99 position. It's a very clever little position. You lie with your feet up on the bed and your back flat on the ground.
Yeah.
It's the most open for the lower back. The back is happy that way. Then bring your legs up into a barrel. Really just try and open up that back, get rid of some of that tiredness that's there from the day, and get going for the evening.
How often should people do that?
I would suggest doing it before bed, and I would suggest getting up in the morning. Because
Right.
in the morning, you're nice and wide and open. Everything's, you know, got fluid in it. You're actually a little bit taller. So use that extra spring in your step to bring your legs forward to your chest, bring them down, start doing a little bit of movement, do a little bit of gradual stretching, and you'll find you get up and you last throughout the day without pain for a much longer period.
Right.
If you do it at night, then you set yourself up for a great night's sleep.
Right. Navanya, in terms of, you know, I mean, we've spoken a lot about exercise now, just extending that a bit into sports now.
Yeah.
How can, as a sports person, ensure that you protect your back?
I also think, as mentioned before, the important thing is to condition your muscles appropriately for whatever sport you're playing. So even if you are a runner, it's still important to maybe go to the gym and strengthen your glute muscles, stretch out your hamstrings. So this will ensure that your muscles are conditioned well for the sport you play. If you're a golfer, it's important to have good thoracic rotation, good stabilizing muscles of the core. So you can do this off the golf course to help prepare you for the sport you're playing.
Okay, so in other words, be well conditioned and make sure that at least your core is as strong as possible.
Yes, and each sport, the muscles you use are slightly different. So in every sport, you need to focus on maybe a certain area more than another sport.
Yeah. What about in people that have some underlying conditions that they're not symptomatic yet, they're at risk, as we described in the last segment? Your advice to such people? Say somebody has arthritis, you know, what should they be doing?
Well, the key thing with even if you have an underlying condition is still just to keep active, keep flexible, and keep your core strong.
Right.
And, you know, the amount of exercise you do, it will vary from person to person. You can still exercise, but you just have to be more cautious with the amount of load you are placing on yourself.
Good. When we went through risk factors, the one thing that we didn't touch upon is age.
Yes.
Could it be that as you age, you're more at risk of, you know, suffering from backache?
Very good question.
And if so, what can the elderly do to protect their backs?
So there's two ways to look at this. Just because you're young doesn't mean you're not at risk. When you're young, you are more at risk for disc problems. So you're more at risk in the spine of hurting the disc. Okay, so you're actually more at risk of doing bigger injuries because you're more able to do things. So you lift things you shouldn't be lifting because you're young and you're fit and you can do it. When you're older, you have degeneration. So now you've got bones that are packed to try and protect yourself, and your movement is not as good. Those bones and joints are now not what they used to be. So they're slightly more weakened. So the elderly also can't overextend themselves. They shouldn't be lifting things that they're incapable of. But saying that, they mustn't ever stop moving. Keep up with the movement. Walk the dogs. You know, keep going. Do some gentle Pilates. Modify your movements as you age. But just because you're old doesn't mean that you're going to get back pain. If you maintain it correctly, you'll be fine. I find in my patients with hip problems, I'm always shouting at them. They have bad hips. That leads to bad hips when you're old. If they're bad now, you'll break it when you're old. So when you're young and you've got a back pain, make sure you sort it out because it's not going to age well. It's going to do you no favors, and then you will be an elderly with back pain. Where we find the elderly without looked after themselves when they were young, or they didn't ever overextend themselves. We find the elderly with back pain had issues when they were young.
Yeah.
So that's a good
She
one.
mentioned exercise and Pilates.
Yeah.
But I mean, these sometimes, you know, need you to go and consult a professional in that field. Are there simple things that people can do, simple exercises? She described the stretching very well, but are there simple exercises that can strengthen the back that people can do at home?
So other than, you say, Pilates or perhaps yoga, well, people can do things like water aerobics.
Yeah.
Even just gentle walking is good.
Right.
A bit of stretching. And even online, you can find many exercises that are just basic to try and stimulate your core muscles. I think it's always important to activate your core muscles and do a bit of stretching that will improve the flexibility of the
In fact, we will, I think, in the next segment, show a little clip just to give people advice in terms of what sort of exercises they can do. But very lastly now, in the last 30 seconds of the segment, we mentioned obesity.
Yes.
Man, what should people do if they're obese? Obviously, in a way towards protecting their back.
Start slow. Please don't start fast. It's not a quick battle. It's a long one. Start somewhere slowly. Start with a walk. Work it up to a slow jog. You know, then you start to get running. Exercise and diet are the priority with obesity. There's no fast fix. There's only the long term. You have to change your lifestyle. the only way, unfortunately.
Yeah, yeah.
So you got to just keep going and stay motivated. Stay motivated throughout it. Have a partner in it as well. Having someone to motivate you externalizes the goal, makes it somebody else's problem as well as yours. So you have to do it then. You know, you have to get out and go for your run if you're meeting your friend at 5 in the morning. It's much easier to say no to yourself than it is to say no to them. So, yeah, so that's a good way. Yeah, and just diet. Diet's a big one.
Yeah, diet is a big one, and unfortunately we don't have time to go into what type of diet, and is it carbohydrates or low carbohydrates. We'll do that some other time. Okay. Now, how is backache treated? That and more after the break. Please stay with us.
Across the globe, locally, and on the entire continent. Every second, every minute, and every hour. There's always a breaking story. We commit to giving you the most important, significant, and interesting news. That's why it is not a surprise that more Africans are tuning to SABC News to find out what is happening. Because when news break, we've got you covered. SABC News, Africa's news leader.
Welcome to Network, a technology news program that also discusses what's trending in social media in and around Africa. MTN has launched its new movie and television streaming service, Front Row. If it's trending, we will find it. That's Network with me, Spumelele Zondi, every Sunday at 7:30 p.m. only on the SABC News channel.
Welcome back to Health Talk. We're talking backache. Now, in the event that you do suffer from backache, what treatment options are open for you? Do you even know who to consult and when? Well, let's understand that from our guests. Lavanya, you know, sometimes people know that there are different types of professionals that treat. There's physiotherapists, there's the doctor, there's the GP, there's the orthopedic surgeon, there's a chiropractor, there's occupational therapist, and so on. Who does what?
Okay, well, I think a good place to start would be either with your GP, physio, or chiro. A chiro and a physio can both diagnose a patient, and then if it's warranted, they can then refer you on to a surgeon or for further treatment. So we are able to diagnose the patient and treat them, so it's a good place to start.
Yeah.
If you're having back pain, we would have physio or chiro, and then at a later stage we might refer you for biokinetics, where they would focus more on the rehab side of it.
Okay, all right. So the first place at least is your physio or chiro or GP.
Yeah.
Okay. Now, before we get to a point where people need to go and consult, are there simple things that people can do at home? You know, they have this dull ache that is more as a result of perhaps, let's say, muscle spasm. They don't have those sinister symptoms that we spoke about earlier that might indicate something more serious. What can people do at home? Simple things.
Great question. So, firstly, you've got a sore back. You want to get into that 99 position that I described. So you want to put your calves on the bed, your thighs down the bed, and your back flat on the ground. Get a heat pack. Heat and spasm work well together. So you want to put some heat on that sore area. Start to get that spasm down. Though, if you've twisted an ankle and there's like inflammation, please don't heat it. Go and put some ice on it. There's a big difference between that and back pain.
Okay.
So
that hot water bottle, you can dig it out and
Another good one, especially patients that are in severe pain and they've tried the heat and it's not working, get into a bath. Fill the bath quite high, put some Epsom salts in the bath, and lie there for a good 20 minutes. After those 20 minutes, stay in the bath and start to stretch the hamstrings by trying to touch the toes nicely in front of you. There's plenty of space in most baths.
Yeah.
And you can really start to feel that the lower back will also start to release. That heat, as well as that water that takes the weight off your spine, will try and help you to try and ease a lot of the pain. Please don't grab the anti-inflammatories. It should never be the first option, especially if it's an injury.
Before we even get to anti-inflammatories, all right, these things that you described now, the stretching and the bath, how long should people do that for before it's time to go and consult?
So you shouldn't do that for prolonged times. I mean, if it's like that for a week and you've been heating and you've been rubbing it and you've put gels on it and you've tried those things and you're still in significant amounts of pain, you need to consult with a physio or a chiropractor. Someone needs to touch those muscles and get in there and really start to release the spasm. The longer a muscle stays in spasm, the more it's going to pull the spine out of alignment, the more you're going to end up with structural problems. So don't leave a problem for too long. You're just doing yourself an injustice in the long run.
People have these... well, they hear about these back support things, you know, the lumbar spine support and what have you. Your comment on that? Can people just go rush, get these things to, either these belts to put around their waist?
I don't think you need to rush and get, if you have very severe pain, then it's good to get a support just for short-term relief. You shouldn't use it for long-term because it actually weakens your core muscles. But for just short-term relief with severe pain, then it is something that one could use.
Okay.
Yeah.
What about bed rest? We're told that it can be counterproductive, yet sometimes people need bed rest. What should people do?
Well, in the past, bed rest was advocated. Now we know that it's not good to be on continuous bed rest. A bit of intermittent bed rest is okay.
Yeah.
But the important thing is to still try and keep active and try and keep functional.
Yeah, but let's make it simple now. What do we mean by intermittent bed rest?
So if your back is sore, you can rest for maybe an hour or so, but not lie in bed the whole day. You need to get up in between and take short walks or do a bit of stretching, just not lying the whole day. So that's what we mean by intermittent bed rest.
Talk about bed rest. We're told that there are some beds that are quite bad that actually can cause backache. You know, I don't know whether it's the mattress or your comment on that.
Your bed, if your bed's old and it's sinking, it's definitely going to give you a back issue. I mean, look at your bed. If it's got a dip in it, your back's going to have that dip in it. So, you know, be kind to yourself. Renew your beds. Look at your beds. Make sure that they're nice and firm. A firm bed is better than a soft bed. You don't want to be soft and squishy in one. You want to be firm so that the back can do its normal alignment and it can do that lazy S that we saw earlier in the clip. So you really need to make sure the bed's firm. Make sure you replace it. Do a turnover if you need to. If you know you're not ready for replacement, then just turn it over. Try and get your stabilizing back in the bed.
Navanya.
Yeah.
We talk about bed rest and beds. What about the position that you lie in?
Well, I think you can lie either on your side or on your back. It's definitely not advised to lie on your stomach because this changes the alignment of the spine. Comfortable positions is also to maybe put a pillow in between the legs if you're lying on your side or underneath the knees if you're lying on your back. So that just helps to maintain that neutral curve of the spine.
Okay, right. All right. Now, people have tried all of these things, you know, they've sorted out their beds, they stretch, they, you know, lie in a bath full of Epsom salts. Or
cold.
All right, and everything is going well, but, you know, they still have this niggling pain, and they know that they have some medication that they keep in the cupboard. What is safe? What is not safe? And for how long should they take this? Any takers? So
they're non-steroidals. So they're anti-inflammatories. Those are the ones we all grab. Please note, any painkiller is an anti-inflammatory. Whether you take Mypadil or Panado, it's got an anti-inflammatory in it. So we always say in an injury, for the first 72 hours, if you can not take an anti-inflammatory in an injury, you are doing world's good. Your healing is going to be nice and on par. If you take it in the 72 hours, you stop healing because you stop inflammation. So then you're going to look at like prolonged discomfort and pain. So let's say you're over the 72 hours and now you're still sore and you're going to take something. There are safe ones. Cataflam's always my go-to because it's softer on the stomach than a Voltaren, for example. So you just want to do something that's soft on the stomach. They're all really not great for the stomach. So make sure you've got enough fiber in your diet if you are taking one. Please don't take them longer than 5 days. twice a
Well,
day,
I would
not
even
3
say
times.
5 days is long.
It's long.
Maybe even 2 to 3 days, in fact. Yeah.
Before you consult a doctor. You can obviously get more aggressive non-steroidals, but those are with prescription for a reason. They're bad for your kidneys, so flush out a lot of water. Mypidol's bad for your kidneys, so please drink lots and lots of water.
So, I mean, the main message there is that take the safe ones.
Yes.
All right.
Softer one.
Okay, then they come and consult you, say, you know, you're my physio, I have had this backache going on for some time now. What do you do?
Well, we'd assess the patient and try and determine what is some of the causes that's causing their back pain, and we'd develop a treatment plan for them. So some of the type of modalities we use are myofascial release techniques. So that's to work out on these tense muscles in the back, release the spasm and the trigger points. We also do joint mobilization just to try and loosen up the spine, increase the flexibility. And then the important thing is to also get a good history from the patient so we can maybe advise them on specific things in their life that they are doing wrong and that's contributing to their back pain.
Okay. I mean, the one common, I suppose, cause of backache would be, you know, muscle spasm and so on, and that you do massage, isn't that so? Mm-hmm. Can people just go for a massage when they have backache?
I don't always advise it because sometimes therapists aren't necessarily trained to find the exact cause of the pain. They're more general, and so they'd work on your whole back, and sometimes it's not good enough. They can maybe activate a trigger point that they shouldn't be activating, or not work long enough on a trigger point, which can then tend to prolong the pain. So I think it's best if you've got pain to go to a trained professional.
Okay, so as a way of protecting your back, you can go and relax and have some good massage and so on.
Yeah.
All right, so chiropractors then, somebody comes to you with backache, yeah?
So we would assess them the same as the physios would. We'd go through a full ortho testing. We'd check the neurological side of things, and we first find out what's wrong. We then obviously have to release. So a joint, your back, works in a 3 mechanism always. It's a bone, there's a neural component, and then there's a muscular component. You can't treat one without treating the other, so you have to do a bit of muscle release. So we do quite a bit of acupuncture. Well, what you know is acupuncture, but it's more dry needling, myofascial dry needling. And then we do a little bit of soft tissue. A lot of kinesio tape is used in chiropractic's office, and then we'll adjust. So we'll do our manipulation. So you'll hear lots of clicks and cracks, and that's when we really try and work on that alignment. So that's our fundamental backbone, excuse the pun, but we need to, make sure that back is aligned correctly. So that's where we want to get to, that deep side, and then we'll work outwards. So we'll work on the muscle, because there's no point in us leaving that muscle. It'll just pull that joint right out again if it's in spasm. Mm-hmm. So we definitely need to release it, work on the cause, which is most of the time the joint or something with the disc, and then we can also do some flexion distraction, which is a bit of traction. So basically just pulling the back apart, giving it some room and some space to open up for the nerves.
Right. You mentioned very lastly, I mean, the dry needling. Let's talk about it for just a few seconds.
Yes.
What's the difference between dry needling and acupuncture, number one, and number two, is it something painful?
Yes, okay. So acupuncture is a form of Chinese medicine. The Chinese docs know it's like there's salt in that. So what it works on is energy levels. So it works on meridians, the yin and your yang. So it balances your energy levels. So it'll work an entire energy field. So if you've got an arm, it will go from the fingertip all the way up into the shoulder, even into the neck, and try and balance out your positive and your negative energy on a neural basis. Dry needling is completely different. That knot that you feel in your trap when you squeeze it, that ball, that's where the dry needle is directed. So it's not directed at many different points, but there are specific points. It goes a lot deeper than an acupuncture needle. It can go about that deep, if people can see at home.
Oh, yeah.
So
but
it
not
depends.
Painful, no?
Yeah, but that's the thing with dry needling. It is painful.
Okay. Well, you know what, ladies? It's been such a fascinating discussion. Unfortunately, we've run out of time, and I want to thank you very much for your contribution. And hopefully people have learned quite a lot, as much as I've learned today.
So.
All right.
Thanks.
So, folk, on that note, that we come to the end of our show today. And join us next week again, SABC News. And please remember to share your views and comments with us on our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. And remember, you can watch today's show at 2 p.m. and 10 p.m. tonight, or if you've missed any of our previous shows, you can get them on the YouTube channel. I'm Dr. Sello, and thank you for watching Health Talk. Please do take care.